will work with hospitals throughout the country to think Ebola in someone with a fever or other symptoms who has had travel to any of the 3 affected countries in the previous 21 days.
As President Obama has asked, the Centers for Disease Control is preparing to double down on its training of healthcare workers that may see an Ebola patient. All this comes after a nurse in Dallas became infected with Ebola while treating Thomas Eric Duncan, who died from the virus on Wednesday. I'm Shannon Rae Green, and this is USA Now for October 14th, 2014. All eyes are on Dallas, where the 26-year-old nurse, identified by her family as Nina Pham, contracted the illness despite wearing protective gear. This raises a question that makes everyone nervous. How prepared are U.S. hospitals to care for patients with Ebola? Some are calling for all U.S. Ebola patients to be treated at one of 4 specially designed hospitals with biocontainment units in Atlanta, Omaha, Nebraska, Missoula, Montana, and the National Institutes of Health in Maryland. Phil Smith, medical director of the biocontainment unit in Omaha, says those 4 hospitals could only treat 8 to 13 patients at one time. He says the U.S. State Department decides which patients get beds at these super hospitals. Officials worry that as the outbreak continues to worsen in Africa and more cases pop up here, the 4 hospitals could not handle all the patients. Preparing for potential Ebola victims is also expensive. Smith says, quote, "Even for a smaller hospital, you need a dedicated staff, special nurses, a special area with a closed door between the surrounding area, special security, special waste handling. Every hospital that commits to prepare is going to have to spend a fair amount of money." The nation's largest nurses organization says most registered nurses at U.S. hospitals have not been given adequate training to handle Ebola patients. National Nurses United conducted a survey of more than 2,100 registered nurses at more than 750 facilities in 46 states and Washington, D.C. It found that just 15% had received Ebola education, where nurses had the ability to interact and ask questions. A spokesman for the group said nurses are being given a CDC handout and directed to the CDC website. Their nursing director at the biocontainment unit in Nebraska says general hospitals need to do more.
What's missing in many hospitals is the level of confidence and assurance in the protocols and processes. And again, I think the meticulous practicing of the taking off of the personal protective equipment.
The Ebola outbreak in Africa has killed more than 4,000 people and sickened more than 8,000, according to the World Health Organization. USA Today is reporting the latest news as it happens in the developing Ebola outbreak story. Stay with us on usatoday.com.